In this podcast, we're going to talk about understanding and interpreting medication orders, which are critical to prevent medication errors. So it's important that we understand each of the components of an order and who writes the order, where do we find the orders. Thank you for joining me. This is Susan Knowles from Cochise College Nursing. It's important to realize that anything in the medical record is considered a legal document. So, a physician or provider's order that's written in the medical record is considered a legal order, but only if it is written by the appropriate person and if it contains all the elements of a legal order. So let's talk about who can write an order. A physician, a dentist, nurse practitioner, nurse midwives, physician's assistants, depending on the particular state in which that person is writing the order. In the state of Arizona, it is legal for all of those people to write orders in medical records. However, those people must be credentialed by the facility in which they are writing the orders. So that's something that we need to be aware of as nurses. Is that person a credentialed provider? And also, depending on the level of expertise of that person, they may need a co-signature depending on the rules and regulations and policies of the facility. So an oral order or a telephone order are at high risk for having a mistake because obviously, do we hear it correctly? Have we carried out all of the appropriate safety guards like write it down when the provider gives you the order, read it back to them, and get confirmation that what you have read back to them is exactly what they want. We need to get the prescriber to sign that within 24 hours of writing that order. And those are really intended to be more of an emergent situation when the provider cannot be right then and there on the spot, and you need as the nurse to carry out a particular order. So in general, verbal orders and telephone orders are to be avoided if at all possible. Now let's talk a little bit about understanding a provider's order. If it's handwritten on the physician's order sheet or an order sheet, or in that particular part of the medical record. If it's done by computer, it will be in the order entry area of the computer area. On a written order, the unit clerk may go ahead and take care of the portions and parts of the order in the sense of faxing it off to the pharmacy if that's what needs to be done, calling another department to set up part of the order, whatever it needs to be done, if an x-ray needs to be ordered, etc. But it's really, really critical for you to remember that the word transcribe an order is a responsibility of the registered nurse. So don't get tripped up by specific questions when you start talking about who does what. Legally, the RN is the only one that can transcribe an order. Transcribing an order to the medication administration record or the MAR, it may be faxed to the pharmacy. That's how it is here locally. It may be that it's order entry, so it automatically goes to the pharmacy as it goes to the MAR. So you'll need to know specifically how that occurs on the unit that you work in, the facility that you work in. The nurse is accountable no matter who transcribes, so to speak, to the MAR. If something is incorrect on the medication administration record, it's not anybody else's fault. It's the nurse's fault for not picking it up. So it is our responsibility to know what the order is and that did it get put onto the medication administration record correctly. And we'll talk more about that in another podcast. So it's important that you start memorizing some of the acceptable common symbols and abbreviations And your textbook has those on table 11-1 and 11-2. And I think that I've tried to upload those to a document for you. As you use them and read them, they will become easier to remember. And just remember that the slide does tell you that some of the symbols have double meanings, meaning that ID means intradermal. It can also mean initial dose. I've never seen it written as initial dose, but that doesn't mean that it can't happen. And we need to be cognizant of the Joint Commission and medication folks that we follow all of the do not use abbreviations and symbols any longer, even though we may still see them in practice. But the other thing that's important to understand is that depending on the type of unit that you're working on, you may use particular abbreviations that are specific to that area. So when you go from one unit to another unit, if the abbreviations don't seem to make sense to you, you need to check to see what are they using those particular abbreviations to mean. So if they're unclear to you, what do? Clarify. Keep in mind that nurses do not write medication orders. And I should have fixed this slide for you. Providers, legal providers, are the only ones that can legally write a medication order. And there are essential components to it. You must have the client's name, the date and time that it's written, the name of the medication, the dose, the route, how often, or the frequency, as well as the signature of the provider. And if any of the pieces are missing, it is not considered a legal order and it should not be carried out. Now, generally in a medication order, it will not contain both the trade and the generic name. You'll have one or the other. And it's important that you look at it carefully, because there are some drugs, in fact too many drugs, that have very similar names and abbreviations. So make sure you use your critical thinking. Does this drug sound like the right kind of drug that would be ordered for this particular patient if it doesn't seem to make sense to you? What is the dosage of the medication? What's the strength? Is it clear to you? Do you understand it? What is the route? How are you supposed to give it to the person? Are you supposed to give it to them orally? Are you supposed to give it to them in an injection? Is this IV? Is this an intramuscular injection? So make sure, because many medications can be given any of those routes depending on how it's ordered. What's the frequency? How often should the patient get this particular medication? Be sure that you understand what QID, TID, BID mean. QID 4 times a day, TID 3 times a day, BID twice a day. Make sure that it's got a legal and legible signature, so you really do know who wrote that order, and does the order need to be co-signed, and if so, has it been co-signed? Then those special instructions, they need to be clear to you. Sometimes they're not written on there. Sometimes those are ones that we know as nurses based on the type of drug that the patient is receiving. If the patient is receiving a blood pressure medication, it's important to take their blood pressure. It's important to know that if their blood pressure is too low, depending on that particular medication, that you hold it, meaning that you don't give it at that time. You may wait for 30 to 60 minutes and recheck their blood pressure, and if their blood pressure is within the range that's acceptable, you can go ahead and administer the medication. Again, on a cardiac medication, you need to check the patient's apical pulse. If it's less than 60, you may hold the medication. If the pulse rate is less than 50, you might need to hold the medication. So again, you need to know the type of what the medication is and the understood holds. And then there may be some other holds that are specifically ordered. Let's look at, again, the elements that are in a medication order. You have the name of the drug, the dose, the route, the frequency. And again, don't forget, you have to have the time and the date, because you need to know when was the order written so that you know when you are expected to begin this order. And in certain drugs, they're only good for a certain period of time, and then they automatically outdate. And of course, you need to have a signature. I have an additional podcast where I talk about a medication order that's through the EduCreations, and I will attach that as an attachment to this podcast. And I want to thank you again for joining me on this particular podcast of Chapter 11 in your medication math course.